Thank you all for joining. And so now we have Mr. Mike Odeh. He is Senior Director of Health for Children Now, and he is going to be talking to us about the ever-evolving landscape of children's health that we'll be having for now and the next few years.
Thanks, Dr. Wright, and Yolanda. Appreciate being invited to speak to you and for you all taking the time. Like Dr. Wright said, I'm Mike O'Day, Senior Director of Health at Children Now. And um, for those of you who don't know us, we are a statewide policy research and advocacy organization working to build power for kids in the state of California. And we work across sectors. I am part of the health team, and so my background is and portfolio focuses on Medicaid and Medi-Cal. So that's most of what I'm going to talk about tonight, but we do a lot of work across different health areas. And so I'm pleased to also share some of what our priorities are for the coming year at the state level. Um, so I'm going to go over some Medicaid basics, not because I don't think you all know what Medicaid is, but because even our current Health and Human Services Secretary gets it confused with Medicare, which is very different. So I'll just sort of level set there, talk about how it works in California, talk a little bit about the federal threats to Medicaid, which I think are very real and concerning, and then switch a little bit to what we're working on for 2025 at the state level. Just to remind us, Medicaid is a federal and state partnership. The federal government has a role, mostly oversight. States have a role, administration. So every state looks different in terms of their Medicaid program. But I think what's important to remember is it is jointly financed. And so the deal is that the federal government shares 50% or more, depending on the service category, of the costs of Medicaid services. So they're an important funding partner in how all of it works. And as you all know, Medicaid is important to sort of the whole healthcare system in the state. And an important feature of Medicaid is in federal law, which is called EPSDT, Early and Periodic Screening, Diagnosis, and Testing, and Treatment. Sorry, I always screw it up. EPSDT, which essentially means that kids get the right care at the right time in the right place. And we are all familiar with how kids can show up at the emergency room for something that could have been prevented or something that doesn't need emergency care. And so really it's thinking differently about how kids get care than how adults get care, and you all know this, but it is sort of in law, and that's an important feature of Medicaid, and we call it sort of the gold standard of children's health. In California, we call it Medi-Cal for Kids and Teens. The state did a rebranding a couple years ago, but Medi-Cal for Kids and Teens is what they rebranded it to, which is what it is. And so there are materials online, including some of these pamphlets that some are geared towards younger kids. And so it shows sort of the developmental periodicity schedule. Other materials are geared towards youth and adolescents. And so it talks a little bit more about substance use and reproductive health. And so there are materials online to make sure that members know what their benefits are and what is covered by Medi-Cal. Medi-Cal covers about 5.5 million kids in the state. So that's about 52 or 53% of all kids in the state. And I think what's important is that 94% of kids in Medi-Cal are covered by a managed care plan. And so it may be Kaiser, it may be Blue Shield, it may be San Francisco Health Plan, it may be something local. But a plan is sort of responsible for making sure they get all the benefits that were just shown in the previous pamphlets. So there's a really important role as for managed care plans as partners in delivering care. And unfortunately, the statistics are not great about how well Medi-Cal is doing in delivering care. So the state has set some bold goals to improve preventive care, improve maternal health care, reduce disparities in children's health services. So these are bold goals. As you all know, change and quality improvement takes a long time in healthcare. But I think sort of the vision has been set that we need to improve Medi-Cal and how it delivers care for kids. That being said, um, we are in an important point in time where um, the federal threats to Medicaid are very real and scary. Like I said, the federal government is an important funding partner, and so threats to those funds really puts Medi-Cal at risk for kids. It really puts all of us at risk, given how important Medicaid is as a funding source for the health system, and for how practices and clinics actually operate. So we know that these cuts could impact kids, and it's important to just remind ourselves like all of the comprehensive services that Medi-Cal uh, covers through EPSDT for kids, right? So it's not just preventive care like immunizations and screenings, but it's the mental health, behavioral health, emergency care, dental care, right? So it's the whole suite of care that we know kids need to thrive. So all of that is at risk because uh, there is really no um, safe cut to Medicaid. I know there's a lot of talk about fraud and abuse in the system. I don't believe that that is true. I believe there is fraud happening and that is rooted out, but I don't believe there's a lot of fat to trim in Medicaid. So it's a very lean program in terms of how things operate. So like I said, the federal threats are real. We've already seen it through executive orders and a federal funding freeze, which is currently sort of tied up in litigation, but again, kind of uh, disrupted some things in healthcare, and I think caused a lot of people concern. What's really worrisome is that their Congress is going to be uh, debating about $880 billion in potential Medicaid cuts. That could look like a lot of different things, like reducing the amount that the federal government participates, putting different restrictions on who is eligible for Medicaid, um, limiting provider taxes. You guys might have been part of the managed care organization, the MCO tax in Prop 35, which addressed some of the low reimbursement issues. And so changes there. They could do per capita caps, which is an old and continuously bad idea on limiting how much per member, per beneficiary uh, can get in healthcare. And I think, the Affordable Care Act got rid of lifetime limits for a reason. And so kind of limiting the federal government's participation really doesn't meet the needs of what Californians need. So I think uh, this list of cuts, which we've just heard a menu of, like we haven't seen any exact real proposals, but the committee in charge of kind of starting all this has been charged with uh, finding $880 billion worth of cuts. And there's really nowhere else to look besides Medicaid because it is such a huge program despite being so lean. There are also non-Medicaid threats that are at play, including the Covered California Premium Tax Credit subsidies. The sort of enhanced subsidies were meant to make healthcare and coverage more affordable for families that are just above the Medicaid income eligibility levels. So for California, it's the Covered California folks. Those could be repealed, probably to pay for tax cuts for wealthy people, but would make coverage unaffordable for working families in California. There's also a very technical family glitch policy rule that made employer-sponsored coverage less available to spouses and children. The Biden administration kind of fixed that. Um, there's talk that that could be repealed, and again, could then make some children under or uninsured. So these are the threats that we know about so far. And while we don't have a lot of specific proposals to react to, we know that these are all really bad ideas and what the consequences would be. So I will stop there and maybe take some questions about any of the federal dynamics because I know it is a very hot topic. Anyone have any questions?
Feel free to unmute yourself if you have a question, or I think I might see a hand up. Let's see that. Go ahead, Dr. Dooley.
Yeah.
Hi, this is a great start because, we've been, a lot of us on this talk actually are already involved in mental health advocacy at various levels throughout the state. And I think it's been unclear to us which of the benefits might be threatened. Would it be the number of children, the services offered? Would it be the family members? You know, um, is there any way to know which of these would be the most devastating in terms of children and youth? Do you have any thoughts on that?
Yeah, well, because we don't have any specific proposals to react to,
Mm.
like if it's hard to know exactly what the impact would be on kids. So for example, work requirements. There's a lot of talk about how there should be work requirements for people to get Medicaid. That doesn't make sense for kids, right? Like kids are going to school, they're not working. Um, so that particular proposal would maybe not have a huge impact on kids directly. It would probably impact some of their parents and family members, right? And so that could be a problem. But um, that one may not be so pertinent to kids. Other ones that are more general, like the reducing the amount that the federal government pays for any Medicaid service or doing the per capita cap block grant, that could impact kids in a very real way by basically cutting dollars that are going towards children's health care. Again, without specific proposals, hard to tell exactly what those impacts are and how kids could be held harmless. Um, I also think that there's sort of the broader point that taking money out of the healthcare system, especially from such a lean running program, really disrupts and affects other parts of the healthcare system. And as you know, you all know, you don't just see Medicaid patients and you don't just see private patients, right? Like there's a mix, and so that mix is really important in terms of how healthcare is financed. And so, sort of sucking money out of the system for no good reason, especially in ways that are potentially really harmful for particular populations is, I think really concerning. I hope that answers your question.
Thank you.
Yeah. Anyone else? Okay. Um, well, sort of with that, oops. Okay. With that, I'm going to shift gears to talking about what's happening at the state level. Um, our leaders have worked really hard to build a culture of coverage in the state, and I don't think they want to move back on that. So I think that's good for California. How we do that in the face of these federal threats, I think, is still unclear, but there are legislative hearings that are getting scheduled and will be going underway, probably starting next month, maybe potentially even this month. So this will be a big part of the discussion. Um, Last month, the governor released a budget proposal that uh, more or less, in my opinion, sort of kept the status quo, um, given not a lot of state budget general fund revenues and what the uncertainty at the federal level. So the budget is not particularly uh, exciting or new this year. So I'm not going to talk a lot about it, but we did do an analysis of what was in the budget for children's health, and it's linked there in the slide. So when you get the slides, you can please feel free to read that. But the governor's budget proposal really kicks off the budget hearings and the legislature sort of debating um, what the governor has proposed. So there will be budget hearings where I think there's going to be a lot of talk about how do we protect Medi-Cal and what we've gained in the state in light of whatever we know at the federal level at that point in time. So it's sort of an ongoing conversation. That being said, we at Children Now have a lot of priorities, some of which are bills, some of which are budget asks, but I will tell you a little bit about them. And it's still very early in the session, so things will evolve and change, but I will go through these one by one and then happy to take some questions afterwards. But first, we are sponsoring a bill related to oral health, AB 350 by Assembly Health Committee Chair Mia Bonta, which would expand coverage of fluoride varnish to commercial health plans and make it easier for Medi-Cal to get billed for fluoride varnish, since we know those rates are low and there are a lot of settings in which fluoride varnish could be applied. And that was just introduced the other week. A bill that was just dropped today, and I can send around an article that was released this afternoon, but SB 363 by Senator Weiner, which looks at health plan denials. First, by requiring health plans to report on what kind of care they're denying. This bill would apply to all services across categories, including behavioral health, and would apply to kids and adults. There's a second part of it which would apply fines if those denials are overturned, which there's some research to suggest that many denials that get challenged do get reversed. And so it's really just a mechanism for plans to keep people away from care that their doctors recommend. And so trying to shed some sunlight and get some accountability there. So that's one of the bills we are co-sponsoring. We're also working on an issue to get hearing aid coverage added to commercial insurance for both kids and adults. This has been a long-standing issue. There was a bill a couple years ago that the governor vetoed precisely because he said there's a process for updating what coverage benefits are included in the benchmark. The legislature is debating this. There was an informational hearing just last week on this topic, and we think the biggest gap in commercial insurance benefits for kids are hearing aids. There's about 20,000 kids that we know use hearing aids that don't have coverage for it. We want to close that gap, and there are many states, 35, I believe, that are doing just that. And so we don't want California kids to be left out. Some other issues we are working on. One is to keep young kids in Medi-Cal covered for their first 5 years of life. There's about a dozen other states that have passed this policy. It requires a federal waiver, but basically says kids under 5 are eligible until they turn 6, which we know makes sense because there's about 100,000 kids that drop off coverage for administrative reasons, not because they're not eligible, but because the systems aren't designed to actually keep people covered. And so it's actually very disruptive to their care and, at a time when development is so critical. So we are going to continue pushing that. That's going to be a budget ask. There will be a bill introduced on the Safer Soap Act, which would ban 3 chemicals that are in hand soaps and body wash that have been shown to be harmful. There was a bill that Assemblymember Bonta introduced to get rid of copays for care for children and youth. And so that would eliminate the financial barriers that sometimes commercial, not in Medi-Cal, but commercially covered kids sometimes face when trying to access care. I'm telling you all of this and letting you know that the legislative deadline to introduce bills is this Friday. So that's why some of these items don't have bill numbers, because they're not sort of formally introduced yet. And we may not know all of the things that are introduced until sometime next week, but our team will be reviewing it. And so happy to report back at a later time to give an update on what are the hot topics in children's health and what is important for you all as pediatricians to weigh in on. So I think that is my last slide. We, of course, have a lot of stuff online, so hope you will check it out, and I will stop sharing and happy to take questions or have a discussion with you all.
Thank you so much, Dr. Mike. This has been really, really informative and very helpful to see what is happening, what's going to be happening. And so again, thank you for this talk. I did have a question about coverage up until the age of 5. I know as a general pediatrician, one of the things that would happen is that the parents would have to renew their insurance monthly. Are they working on that at all? Is there any works so that kids don't fall through? Because this is one of the things that a lot of Medi-Cal families have to do is just constantly renew.
Yeah. So kids are supposed to be eligible for 12 months continuously. So when they enroll, they're enrolled for the following 12 months. Um, that's what's on paper. That's what's supposed to happen. That's not always what happens. And so for various reasons, because the county missed paperwork, because they changed an address, because of whatever, kids fall off coverage, even though they're still technically eligible. And so we're trying to essentially extend that 12 months into a longer time period. I think in doing that, there will be some of those system fixes to make it a little bit tighter so that people are not erroneously falling off coverage. And it's a super inefficient thing. Like the state is paying to disenroll and re-enroll the same person, it makes no sense.
Yeah.
So, yeah. I see a hand from Dr. Saba.
Yeah, hi. Thank you for this talk. It was great. I guess that my question is if about AB 298, this BONTA prohibiting out-of-pocket healthcare costs for those under 21. I worry, I mean, I like the intent, but I
Uh-huh.
worry about the unintended consequences of people just coming into the doctor all the time or making appointments all the time that they don't need, and how that could actually limit access to care. So if you know if there's any kind of guardrails on that.
I don't. That's a really good point. We have not been involved in that bill. It was something that the assembly member wanted to do, just to be totally candid with you all. So we're still reviewing it. And I mean, obviously we love the intent too, but um, I don't know that in talking to parents, I don't know that I've heard a lot that the copays are the barrier. Um, I mean, families that have copays seem to be able and willing to pay them. So it's not a complaint or it's sort of a pain point that I hear a lot about. Um, but curious if you all are, and I appreciate this feedback about, does that think people can get more, right? And sort of demand more healthcare because it's that that piece is removed. So yeah, would love any other thoughts on that particular bill or any other questions.
I have a question.
Yeah.
Oh, hi, Harvey Kaplan from San Mateo. So my question is about public healthcare sources, county hospitals in each county. Is there any plans or any thoughts about beefing up these safety net providers, particularly in counties that have high immigrant populations? Because that's where I spent most of my practice, and that sort of tends to be what happens. So when systems fail, people show up at the county hospital. So I'm just wondering if there's any thoughts now of trying to improve the funding for that.
Yeah, I have not heard anything specifically on that. I'm sure our friends at the public hospitals and the clinics are thinking about that, and I assume it will come up in some of the budget conversations that the legislature is going to have. I just haven't personally
Yeah.
heard anything. Yeah,
By the way, say hi to Ted. Harvey
I will.
Kaplan. Hello. Okay.
I will. Thank you,
Okay.
Dr. Dooley. I see your hand again.
I had two questions. Thank you. One is the Senator Weiner's. I guess that's just fresh off the press. Everything is. But I think most of the issues that pediatricians have with access is not due to denials, because most of the things that we refer to, at least for Medi-Cal, don't have a requirement for prior authorization. So the denials happen more in certain very expensive procedures and extremely unusual interventions that might be asked for a child or youth. I don't know. Do you know, is anyone working with them on the issue of recognizing what types of denials occur in the first place? Because I used to work for one of the health plans, and as a pediatrician, they would only come to me if they had like a medicine that was going to cost $50,000 or something.
Yeah.
So depending upon how that law is interpreted and the system of care, it might not have a lot of impact, would just be my thought. A couple of $50,000 drugs might go through that didn't otherwise, but
Yeah. A couple thoughts. The bill does not apply to Medi-Cal. It
I
would
think
just apply to commercial insurance. That's a big part of why most of the bill is a reporting bill. We don't actually know how much care is denied. Plans don't have to report it, so we only know what plans get what denials get recommended for an independent medical review. And we know that there are barriers to who can file an independent medical review. And we also know that most of those independent medical reviews, especially around children's behavioral health, then end up getting overturned. And so I think trying to better understand what is the problem and how are denials being used, is part of what we're trying to get at. But encourage you to check out the bill language, and if you have specifics on like how it can be improved. I will also say that we are trying to gather human impact stories, and so if you have any that you're willing to share, I will um, uh, send around the forum to you all, so you guys have that. I also am dropping in the chat the article that came out in Kaiser Health News today about this particular bill. So yeah, if you have any feedback, would love it from your sort of front lines perspective. It's really helpful.
right. And of interest is a number of the people here are working on an issue of concern with the mental health system for kids, in that it's a very convoluted, unclear, non-validated system of obtaining access. When kids are referred to the mental health system, we're encouraging providers to make direct referrals because we've already done a screen and we have information, but it's even unclear how providers can do a direct referral, whether a repeat screen has to be done. There are incredible barriers which actually violate the federal mental health parity law, which says that you can't make it more difficult to access mental health services than medical. So I think the question we have right now, the CMS is looking at ways to enforce this law. And I think it's essential because in California it's resulting in incredibly low rates of access to behavioral health services for children and youth. And do you know, are any of these bills or is this something that is a change that needs to be made just in the administrative level, in the contract level? I mean, how would you recommend addressing an issue like this, where a clear federal law is being violated routinely, and yet California has not been held accountable for that?
Mm-hmm.
Have you guys worked on this already?
That falls in my colleague LaShawn Francis's portfolio. I know she's thought a lot about this, so I can connect you with her if you're not already connected, but I would defer to her on what she thinks the best way forward is.
Yeah, we have been working with her, and I think in a time with the budget cuts, maybe it's important to make sure that the resources we have are being put to the best use possible if there's
Yeah.
not supplemental money to straighten the system out. Thanks.
Yeah, absolutely. And I mean, we hear about the screening fatigue from parents and youth about, how many times they're asked the same question and
Mhm.
for what. So, yeah, definitely an issue worth trying to figure out.
Yeah,
Thanks.
I think you're right. The human stories would help but move that along.
Yeah. Anyone else?
Yeah, I have a question. Thank you so much for your presentation. That was really informative. One thing I think a lot about in the current federal landscape is living in California, where a lot of our congressional representatives are pretty liberal and support a lot of the policies that that children now and that most pediatricians I think here would support. What do you think are effective ways for us to advocate, anticipating some of these kind of, it's been said before, it'll be probably brought up again, these old proposed cuts to spending that get brought around every few years?
Yeah. I think I've seen a lot of the federal groups, including AAP, sort of get on the same page about how to organize around this. I think there are uh, so I think sort of plugging into those national groups that um, uh, are more attuned to what's going on is always good, and hopefully we can all sort of be echoing the same messages. I also think just in terms of the political sort of power mapping, you know, the House has to do something in order for any of these threats to be real. We, of course, don't want them to do anything bad. And there's about 10 members that are sort of these, I've heard them described as swing votes. I don't know. Anyway, three of them are from California. And so we can put a lot of pressure on them to make sure that they know that any of these bad ideas are bad for Californians and bad for their constituents. So I think that's the leverage we have right now. That could all change if they come up with some details. So, it'll be a little bit of a moving target, but I think for now, plugging into national groups and state coalitions and really putting the pressure on those key members. Anyone else?
Thank you so much, Mike, for this talk. I see there was a lot of new people on the call. And if you all are interested, of course, this is the year, I guess, or the next few years, we'll be having to put our uh, basically roll up our sleeves and to advocate for better health for the kids. So if you are interested in joining our committee, feel free to reach out to myself or Morgan or um, she was on the call. I guess she left. Um, uh, Stephanie. Um, but yeah, no, really, really glad that you all were able to join and to hear what is going on and what will be going on. Thank you again, Mike, for everything, all this information.
Thanks for having me.
Great. Thanks
Yes.
so much, Mike, and thanks, Maria, for facilitating. We have some really amazing advocates on the call. So since we just have a little bit more time, I was curious if anyone else wanted to share advocacy updates or opportunities. And I did put a link in the chat if anyone wants to join the committee. We don't send that many emails, so you won't get too much spam, but we will send relevant advocacy alerts at times, and we'll send you notice when we're having meetings such as this. We try to have meetings about quarterly, and we are in the process of applying for a chapter grant to have a social event sometime this summer as well.
Well, thank you again for joining.
I don't have it right now, but you might put it on the chat the AAP advocacy link where National AAP is putting out really great materials as Mike mentioned. And we have a chance to go online and support those with, again, either a prefab or a personal story. So it's on the national website, AAP advocacy. You have to be a member, but otherwise they make it really easy.
Any last minute comments before we let everyone go for the evening?
I guess just one
And here's
last
the, oh,
thought is, just this with the state budget and the fires, and whether there's going to be, some reprioritizing around, what the most urgent needs are. I don't know if Mike has any thoughts on that or.
Yes, I think there will be some reprioritizing, especially because resources are feeling scarce. Um, I think the thing that I'm kind of worried about is how this can pit us against each other. Providers against the patients they serve, seniors against children's interests. Those are not the fights we want to have, right? And so I think we need to be really careful about not being split up, and kind of standing in solidarity to protect what we have, because it sort of affects us all. So I guess that's what I would say in this reprioritization, like keeping that sort of foundational perspective of being in solidarity with the communities we're part of, is maybe the best advice I have at the moment.
And another little question that I know some of us work for federally qualified health centers, and I don't know whether there's been any talk. When I raised the concern, I think we have a strong, advocacy here in California for our federally qualified health centers, but I'm just wondering if there's been talk that you've heard of at the national level.
Not that I've heard of, but I'm not sitting at those tables.
Yeah.
But yeah, I mean, I'm sure they are talking, and very concerned about what this all means.
And I guess my last thought is that, as many of us serve immigrants, I think, there's a lot of fear around, public charge and using, even applying for and keeping what they are qualified for. So I just worry that they, drop that. And then, we're back to having a lot of uninsured children in California. So
Yeah. And I've been hearing actually I'm curious if you all are experiencing this too, but some kind of immediate effects of families canceling appointments, no shows, just scared to come in or even engage.
yeah, I
I
think
see some
those kinds
heads,
of
yeah.
stories would be very helpful to start collecting, because I think, there's a lot of consequences from delayed care and avoiding, clinics and
Yeah. And
using services.
I think you all seeing patients can speak to some of those stories in a way that, I as a policy person cannot. So I think really think about what those compelling stories are that you can bring to the advocacy, because I do think I always find it really powerful when I hear some of those horror stories that you guys see as pediatricians. So I think there's a lot of power to that.
I have a question, which is how can we best continue to work together, Mike? Your organization does really amazing work. I'm sure you have a lot of other stakeholders who you're working with as well, but how can we as pediatricians and us as this advocacy committee continue to work together with you?
Thank you. I love that question. So I think there's a few different ways, just as individuals. We organize something called the Children's Movement. And so we have a newsletter and a listserv where you can get updates, and that's probably like one way of knowing what we're up to and what we think is the most important thing for kids. We work a lot with your state chapter, I guess they're I don't know, chapters. So with Carmi and folks and uh so we try to align there so you guys are hearing kind of consistent messages because there's a lot of noise out there. But I love coming to talk to you all because you are uh really on the front lines doing things, and so I love the um passion and interest in the policy and systems change and advocacy. So I'm happy to come back and sort of report back to you all, or if you want a list of bills, we can make one for you. Anything to make your lives easier, because like I said, I think you all have a powerful perspective, and we want to make sure that we can provide you with the best advocacy information to use that voice.
I think that would be great, even if in a few months, because it seems like it's going to be an ever evolving, changing and thing. And so being updated as to what the bills are and what we're working on and what isn't working or what's been thrown out or not looked at would be helpful for us, I feel.
Great. Yeah, happy to come back.
Yes, thank you. Any last minute comments, questions? Otherwise, we'll let you all enjoy the rest of your evening. Thank you. Thank you so much for coming. And thank you again, Mr. Odeh, for being here. Thank you so much. Good night.
Good night. Thank you all.
Good night.